Hello, and welcome from the Healthcare Authority. My name is Tyron. My co-facilitator for today's training is Laura. We are two of 7 program specialists with the agency that work in the Medicaid Administrative Claiming Program. The goal of this training is to help time study participants understand the documentation requirements needed as they fill out the time study form, the importance of why time study forms should be filled out in such a manner, and the recommended narratives for the MAC activities you may encounter. As you watch this training, we recommend that you have a copy of the time study form and a copy of the activity codes as seen in the MAC manual so that you may make notes. Let's talk about background and context for just a moment. Medicaid Administrative Claiming, or MAC, is a program through which contracted governmental agencies are reimbursed for administrative costs associated with Medicaid outreach and referral activities. The Centers for Medicare and Medicaid Services, also known as CMS, manages Medicaid nationally. Healthcare Authority is the single state agency in Washington that runs the Medicaid program for the state. The goal of the MAC program is to enhance access to Medicaid services.
The U.S. Department of Health and Human Services, Office of the Inspector General, OIG, is focusing on reviewing the MAC program nationally. OIG will be taking a deeper look to determine whether costs were properly allocated and claimed to Medicaid. Additionally,
CMS put the Healthcare Authority on notice to ensure contractors retain better support documentation for their administrative claiming. As HCA program staff conduct ongoing monitoring and technical assistance visits, this has been an area of concern.
For these reasons, HCA is providing this best practice information to reduce the school district risk of potential audit findings and possible financial impacts related to the recovery of funds.
Let's look at narratives for the time study form. Participants must report 100% of all activities they perform during the regular school day or base contract hours on the time study day. The use of parallel activity codes ensures the time study captures 100% of the time spent on all activities. This means time study participants must record time for non-reimbursable activities in the appropriate A activity code, as well as time for reimbursable activities in the appropriate B activity code. CMS requires a brief narrative describing how the activity is Medicaid related for all B activities. A narrative description for A activities is optional. Healthcare Authority recommends that time study participants record narratives that sufficiently detail their activities or have supporting documentation on file for reimbursable activities recorded on the time study forms.
As a best practice, HCA suggests narratives describe in clear detail what activity was being performed and how it relates to Medicaid. Narratives should also clearly describe why the activity was being performed, who else was involved in carrying out the activity. Appropriate narratives should include what were you doing, why were you doing it, who were you doing it for, and how did it relate to Medicaid?
Let's focus our attention on the time study form. Again, it may be helpful if you have a copy of the time study form and a copy of the activity codes so that you may make notes. Also remember, B codes require a narrative. Narratives for A codes are optional. Medicaid Outreach, Activity Code 1B. This code is used when time study participants are performing activities that inform students or families about Apple Health and how to access the program during their regularly scheduled work hours. Here's a scenario. The second grade teacher, Ms. Perkins, learns that Marcus doesn't have medical insurance. She contacts his parents and informs them about the benefits of applying for Medicaid and having a medical home. The parents do not own a computer. They plan to visit the local CSO office to apply.
On the time study form, the narrative was recorded as gave a parent information on available health services. Referring back to what appropriate narratives should include, let's determine what is missing from this example. What were you doing? The time study participant gave a parent information on available health services. Why was it being done? This part is not clear from the narrative. Who was it being done for? Not clear, again, from this narrative. What was the information for the student? If so, which student? Was the information for the health of the parent? How does it relate to Medicaid? Not clear in this example as well. The best practice narrative for this example would be: inform the parents of a new student about Medicaid Apple Health Services and encourage them to apply for coverage. For this response, the appropriate answers to the questions are provided. What were you doing? Providing information to the parents of a new student number 76298 or the initials of the student MK about Apple Health Services. Why was it being done? I'm encouraging the parents to apply for coverage. Who were you doing it for? The new student number 76298 or MK. Remember to use the student ID or initial. How does it relate to Medicaid? Gave information about Medicaid Apple Health Services.
Let's look at another example. The high school nurse, Miss Jones, from the ABC school district learns that a student in the district named Rhonda is pregnant and does not have medical insurance. Ms. Jones contacts Rhonda and spends time giving Rhonda information about maternity support services. What was entered as a narrative on the time study form for 1B is, talk to a student about access to care. Referring back to what appropriate narrative should include, let's determine what is missing. What were you doing? This question is answered, talking to a student about access to care. Why were you doing it? Is not clear from this entry. Who were you doing it for? A student? Okay, but which student? How does it relate to Medicaid? Not clear. For this response, the recommended narrative would be, provided student number 76298, or RK, who is pregnant and does not have medical coverage, with information about maternity support services. Now, the answers to the questions are provided with this narrative. What were you doing? Providing information about maternity support services. Why were you doing it? The student is pregnant and does not have medical coverage. Who were you doing it for? Note that the student identification number is used or the initials have been used. How does it relate to Medicaid? Maternity support services are covered by Medicaid.
The next activity is facilitating applications using code 2B. This code is used when the time study participants are assisting students or families with completing Apple Health Medicaid applications. Here's a scenario. Jody is a first grade student who continually complains about her teeth hurting. Often she is unable to eat her lunch. Her teacher, Mrs. Jackson, calls her parents and tells them about Jody's complaints. In the process, Mrs. Jackson finds out that the family has no dental coverage. The parents meet at the school and Mrs. Jackson helps in applying for Apple Health.
What is entered as a narrative on the time study form for 2B is, help fill out an application. Referring back to what appropriate narrative should include, let's determine what is missing from this narrative. What were you doing? This question is answered, helping to fill out an application. Why was it being done? From this time study entry, it is not clear. Who were you doing it for? Not mentioned. How does it relate to Medicaid? Again, not clear. For this response, the recommended narrative would be, assisted student number 76298, or JK's family, in locating an in-person assister for help in filling out an Apple Health web application. This narrative provides answers to the questions. What were you doing? Helping a family locate an in-person assister. Why were you doing it? To complete an Apple Health application for medical coverage. Who were you doing it for? Note again, the student ID or initials have been used. How does it relate to Medicaid? The application is for Apple Health. Here's another scenario. Kyle. Kyle's family moved into the area 2 weeks ago. When the school secretary, Ms. Johnson, helps his parents fill out registration material, she finds that the family is low income and has no medical insurance. The secretary takes Kyle and his parents to the school counselor and tells the counselor that Kyle might be eligible for Apple Health. The counselor registers Kyle for school and helps the parents fill out an Apple Health application. The entry that is made on the time study form is, I helped fill out an application.
Is this narrative entry sufficient? Does it fully answer the questions, what were you doing, why were you doing it, who were you doing it for, and how did it relate to Medicaid? Unfortunately, this entry does not complete the picture for a Code 2B narrative. The suggested narrative for this scenario would be, assisted student 76298 or KK's parents to complete a Medicaid application because the student needs a well-child exam and does not have medical coverage. Let's look at the next activity code, arranging transportation, using Code 5B. This code is used when time study participants are working with Medicaid transportation brokers to arrange transportation to Medicaid-covered services. Here's the scenario. Tanner needs to get to his appointment with his Apple Health provider so his medication can be renewed. Mr. Anderson, the school counselor, calls the Medicaid transportation broker to set up the transportation.
The narrative that's entered on the time study form for 5B is transportation for a medical issue. Let's determine what is missing from this narrative. What were you doing? Arranging transportation. Why were you doing it? Transportation for a medical issue. Who were you doing it for? Not clear. How does it relate to Medicaid? Not clear as well. According to our best practices model, the narrative for this 5B example would be, call the transportation broker to arrange student number 76298 or TK's transportation to a behavioral health appointment with Catholic Community Services. This response is sufficient because the questions we have been working from have been answered. What were you doing? Arranging transportation through the transportation broker. Why were you doing it? Student had appointment with Catholic Community Services. Who were you doing it for? The student ID number or student initials have been used. How does it relate to Medicaid? Arranging transportation to a Medicaid covered service. Let's look at the next activity code, program planning, policy development, and interagency coordination related to medical Medicaid services using Code 7B. Time study participants use this code when collaborating with other agencies or providers on strategies to improve the coordination and delivery of Medicaid health services to students. Remember, Code 7B should be claimed only by the time study participants that have program planning, policy development, and interagency coordination in their job descriptions. Here's a scenario for Code 7B. Mr. Anderson, the principal, has job duties that include coordinating community services for students. He is in the process of contacting Evergreen Alcohol Drug Treatment Facility staff to set up a meeting. The purpose of this meeting is to coordinate health services for students who are Medicaid eligible.
The narrative entered for this 7B example is, attended a meeting on coordination of health services. From what we have seen with our best practice model, this entry is insufficient because it does not fully answer what were you doing, why were you doing it, who were you doing it for, and how did it relate to Medicaid. The best practice recommendation for this scenario would be, attended a meeting with Evergreen Alcohol and Drug Treatment Facility staff to discuss the referral process for students with drug or alcohol problems. This recommended narrative answers all the key questions. What were you doing? Attending a meeting with Evergreen Alcohol and Drug Treatment facility staff. Why were you doing it? To discuss the student referral process. Who were you doing it for? Students with drug or alcohol problems. And how does it relate to Medicaid? This meeting, again, is a collaborative effort to discuss, in general, how the referral process works when referring students for Apple Health covered services. Let's look at another scenario utilizing 7B. Mrs. Stewart, the school principal, observes a need for better coordination with the Health Benefits Exchange in helping students and their families apply for Apple Health. The narrative on line 7B on the time study form is recorded as, attended a meeting on coordination of health services. Again, from our best practices model, we can see that this narrative is insufficient and does not completely answer the questions. What were you doing? Why were you doing it? Who were you doing it for? And how does it relate to Medicaid? The best practice entry that is recommended in this scenario is, attended a meeting with the local in-person assister organizations to discuss the referral process for students who need assistance with applying for Apple Health through the Health Benefits Exchange. This narrative answers the key questions. What were you doing? Attended a meeting with the local in-person assister organization. Why were you doing it? To discuss the student's referral process. Who were you doing it for? Students that need assistance with applying for Apple Health through the Health Benefits Exchange. And how does it relate to Medicaid? This meeting is a collaborative effort to discuss, in general, how the Health Benefits Exchange process works when referring students.
Hopefully at this time you are noticing the pattern here. We're answering questions, what were you doing, why were you doing it, who were you doing it for, and how does it relate to Medicaid. Let's move on to the next activity, medical Medicaid-related training using Code 8B. Time study participants use this code when coordinating, conducting, or participating in training events regarding the benefits of Medicaid-related services, how to assist families to access such services, and how to more effectively refer students for services. Here is a scenario using Code 8B. During one of the first days that teachers are back at school, the district sponsors an in-service to all time study participants on the availability of Apple Health services to students or families by a local provider. The entered narrative on the time study form for 8B is attended training on health issues. Referring back to appropriate narratives, what should be included on this entry? Let's determine what is missing. What were you doing? The question is answered, attended training. Why are you participating is not clear. Who were you doing it for is not mentioned. And how does it relate to Medicaid? Again, not clear. For this purpose, the recommended narrative would be attended training provided by Pioneer Family Practice on the process for referring Medicaid-eligible students for well child exams. Again, the questions are answered. What were you doing? Attending training by Pioneer Family Health. Why were you doing it? To learn about the process for referring. Who were you doing it for? Medicaid-eligible students at the school district. And how does it relate to Medicaid? Well child exams are covered by Medicaid.
Let's take a look at Code 9B, Referral, Coordination, and Monitoring. Time study participants use this code when making referrals for, coordinating, and monitoring the delivery of Medicaid cover services. Let's look at a scenario using Code 9B. Sam has been repeatedly referred to the principal's office for discipline. His parents were called and they met with the principal, Mrs. Jensen. It was agreed that Sam should see a physician to determine if his disruptive behavior could be substance abuse related. The Medicaid provider that Sam sees requests that Mrs. Jensen write up a summary of observed behavior needed to assist with Sam's diagnosis. The narrative entered for this 9B activity is gathered information for health concerns. Again, according to the best practices model, the key questions, what were you doing, why were you doing it, who were you doing it for, and how does it relate to Medicaid, are not completely addressed. The best practice recommendation for this scenario would be wrote up a summary of observed behavior to make referral for student number 76298 or SK for substance abuse evaluation with the Evergreen Treatment Facility. The key questions are addressed in this response. Let's review. What were you doing? Writing up a summary of observed behavior. Why were you doing it? Making a referral. Who were you doing it for? Student 76298 or SK, the student's initials. And how does it relate to Medicaid? Substance abuse is an Apple Health Medicaid covered service.
Here's another scenario for Code 9B. Jack. Jack has been repeatedly referred to the principal's office for discipline. His teacher, Mr. Ryan, is concerned and consults with the school nurse to determine if his disruptive behavior could be substance abuse related. The nurse requests that Mr. Ryan write up a summary of observed behavior needed to assist with Jack's diagnosis. What is entered for 9B is monitoring substance abuse. According to the best practice criteria we have been using, the important questions have not been answered. The sufficient narrative would be, met with the school nurse and provided information related observations regarding student number 76298 or JK in my class who seems to be lethargic and has difficulty concentrating. I explain I have concerns the student may have possible substance abuse issues and developed a plan to continue observing the student's behavior and report back to the nurse once a week. This narrative provides answers to the questions what, why, who, and how. What were you doing? Met with the nurse concerning the student's behavior. Why were you doing it? Concerned about a student that may have substance abuse issues. Who were you doing it for? Student number 76298 or the initials JK. How does it relate to Medicaid? Substance abuse treatment and monitoring is a Medicaid covered service.
Let's look at one more example for Code 9B. Sally sits near the front of the classroom but is unable to read the board. Her parents are notified by her teacher, Mrs. Forrest, and she assists them in making an appointment with Sally's Medicaid provider for an eye exam. Mrs. Forrest gets written permission from Sally's parents before calling the provider. The narrative that was recorded for this activity is referred a student for a medical concern. The recommended narrative would be student number 76298 or SK complained of difficulty seeing the whiteboard. Called a parent to suggest scheduling a vision exam for student SK.
And just a note, remember, Healthcare Authority recommends that referral activities specifically state who or where a referral was made to, and the coordination activity should clearly explain what services were being coordinated and specifically state who was involved. Let's look at support documentation. Again, Healthcare Authority recommends that time study participants record narratives that sufficiently detail their activities or have support documentation on file for reimbursable activities recorded on time study forms. Now, let's focus our attention to the support documentation. As another best practice, Healthcare Authority recommends that the time study participants provide or have support and documentation on file for reimbursable activities recorded on the time study form. Support documentation examples include a plan books, chart notes, activity logs, or calendars. Time study participants are encouraged to include notes in their documentation to provide enough details of their activities that includes the date and time the activity was performed, so it can help them recall their selected responses in an event of an audit. Other examples of support documentation: travel logs that reflect the date and time span with notes regarding the purpose of the travel, phone logs that reflect the date and time span with notes regarding the topic of phone conversation, a meeting agenda with notation of the topics being discussed, or an email to yourself that provides details of the MAC activity performed and, if possible, other documentation to support the details.
We will close this training by addressing the retention schedule of time study forms. As a reminder, completed time study forms and their support documentation of activities claimed on time study forms must be maintained by the district. All information must be maintained on-site for a minimum of 6 years as required by the interlocal agreement between HCA and the school district and other state and federal regulations.
Thank you for your time and participation. If you have any further questions, please contact your MAC program specialist. We have a frequently asked questions page concerning documentation requirements. This training and the frequently asked questions can be found at the following website.
If you need more resources for families, the following websites may be useful.
Thank you once again, and for more information on the MAC program, please visit the MAC website as follows. Have a great rest of the day, and thank you.